You're going live through the Healthy Living page, right?
Yes, yes. Good afternoon, friends. I'm Dr. Aajay Shah, and I'm bringing you this great live today from one of my mentors, and matter of fact, one of our role models. Thanks for joining us on Facebook Live and also on Zoom. If you are on Facebook Live, please share on your Facebook page. You can also start a watch party on your Facebook, so a lot of your friends and family will be able to join. Let me assure you, today's live will be one of the most learning and helpful live, not just to yourself, but to all your family and friends. So start a watch party and share on your page. This will be on YouTube in a few hours. So if you have to leave in the middle of the meeting, don't worry, this will be on YouTube in a few hours. Let me give you first update on our page. We have now 35,000 followers from all over the world, actually. We have achieved this just in 6 months, thanks to my family and thanks to Hannah, our social media director. We are bringing about 5 to 7 guests every week now on our live, and there is a tremendous amount of interest in learning from all our guests. And today you realize that guests are so important. I think I realized that I cannot alone myself educate every aspect of lifestyle medicine. And all these great guests are contributing every day pretty much on educating and teaching everything everybody needs to know. Uh, we have we have expanded our pillars more than the 6 classic pillars of healthy lifestyle, and you can read the pillars on the screen on my background. And we have realized that keeping a person healthy is more than just eating healthy and exercising. It requires financial health, parenting, woman empowerment, many other pillars of being a successful person. So again, big thanks for all of you.
Hello. Hello.
So big thanks to all of you. Let me introduce our guest. I saw him first time. I saw him first time. Salona?
Hello. Hello.
I can hear you, Koushik.
Oh, you can hear me. Okay, so you're breaking up for because your voice was not coming through.
I saw our guest first time in a ACLM, American College of Lifestyle meeting in Indianapolis. In a crowd of 2,000 people, he stood up from the front of the audience and made a case for treating heart disease he made a case for treating heart disease with a carrot first and not with a stand. I was absolutely mesmerized by his passion, his evidence-based knowledge, and definitely his energy. He's a scientist, he's a mentor for many of us, an interventional cardiologist, a fellow now of American College of Lifestyle Medicine, which itself is the greatest honor. He's a whole food, plant-based vegan. He's a leader, he's a visionary, an encyclopedia of different type of knowledge, not just medical knowledge, and avid reader, and a great friend. And he is Dr. Koushik Reddy. Let's welcome Dr. Reddy. Welcome, Dr. Reddy.
Hey, thank you, Ajay. Thanks for that kind introduction, and appreciate the support and appreciate you inviting me to speak here. And this is amazing. I really want to congratulate you and your team in making this effort to take this message, a very simple yet a very powerful message, across the country and across the world, in a selfless and in a very meaningful way. For that, you truly deserve appreciation and recognition. I really want to thank you for setting up this platform, so where someone like myself and many other people who have been guests on your show have been contributing enormously and selflessly, with only one mission, is to pass on this message of the power of lifestyle medicine to as many individuals as possible, so we bring out the healthiest possible us out of ourselves. Thank you for that introduction. Appreciate it. Are you able to hear me, Ajay?
Yes, I can hear you.
Yeah.
Again, please tell Dr. Reddy, where do you live and what kind of practice study you are in?
I live with my family, wife, and three kids. We live in Tampa, Florida, and I graduated in 2007. And all these years, I've been working at just one place. I work for the U.S. VA Veteran Health Administration, and I have a faculty appointment at the University of South Florida in Tampa. So yeah, can't complain. Life has been good to us. Been here for almost 14 years. Being by just virtue of being at the VA, being involved with some degree of academic medicine and cardiology, and yeah, Tampa, Florida is home.
That's great. So let's dive into our discussion.
Sure.
Let's spend 2 minutes on setting the stage for Dr. Reddy's presentation. Dr. Reddy, please tell us briefly some of the chronic disease in America and in the world, and why they are becoming more and more common.
So not just some, but almost all common chronic diseases. We're going to touch upon this nicely during the presentation, but almost all common chronic diseases such as high blood pressure, diabetes, high cholesterol, heart attacks, type 2 diabetes, and arthritis, dementia. For the most part, majority of the common chronic diseases that we ourselves or someone close to ourselves in our personal and professional lives are suffering with are all preventable. Majority of them are preventable. Literally, I've been in medicine, I've been in cardiology for almost 20 years now, but I've been in medicine for 30 plus years. The diseases that I treat, and if I really look at the true 100% pure genetic component of what I do, is literally less than 2 to 3%. 95 to 97% of everything, the likes of myself and Dr. Shah, both of us are cardiologists, the diseases that we treat, the risk factors that we treat, should not really actually exist in 21st century, but they do. And it turns out, if you really kind of, look at them from a kind of a 20,000 foot view perspective, almost all of them are directly related to one larger component called lifestyle medicine, or lack thereof, unfortunately. And so that realization came to me in 2016, 2017. And, it kind of started as a personal enlightenment, education, and kind of stuff, then became a passion. And now, just like what it has become for Dr. Shah, likewise for me, has become my life's mission to take this message to as many people as possible. So in a way, he and I are trying to make ourselves go jobless. Well, where is the fun in doing the easy stuff, right?
Yes, yes.
Yeah. And also, if you really look at it within the component of lifestyle medicine, based on pretty well, observational data, majority of the common chronic diseases within lifestyle medicine, pillars of lifestyle medicine, kind of point towards one singular lifestyle medicine for the most part, which is the food that we eat. All right, are we still on?
So let's have Dr. Reddy show his presentation.
All right, so you're able to see the slides, right, Dr. Shah?
I can see the slides, yes.
All right, once again, thank you, Dr. Shah, and again, the audience, thank you for joining us on this Saturday afternoon. Hopefully, we will make it worth your time. So right up front, I have no disclosures, financial or any other kind. Like I said in my brief introductory words, I am a public servant. I work for the VA. I don't do this for money. I don't do this for glory. I just do this as a labor of love to just get people healthy, because that's what we go into medicine, is to make people healthy, not just manage disease. And another simple disclosure is that this presentation, being it's a conversation between two cardiologists on social media, this is purely for educational purposes only. This is not, and I repeat, this is not a professional medical advice. Please seek or consult an opinion with your physician or a cardiologist before making any dietary or lifestyle changes. This is extremely important. And like I said, I work for the VA. And again, a shout out and a word of thank you for all the veterans who are joining us. If you're a veteran or you're a family member of a veteran, again, on behalf of myself and a grateful nation, thank you. These words are a motto of the VA, is to care for him who shall have borne the battle, and for his widow and his orphan. I mean, these words are really engraved almost at every VA hospital. This is built into the very fabric of someone like myself as to why we do what we do at the VA. And again, thank you for the veterans, and thanks to the VA for giving me an opportunity to work there all these years. And another thing I just want to put it out at the front is just much like what Dr. Shah has been doing with his time and with his busy practice. And on Saturdays, he just, before we took the call, he said this has become his second job, right? So this is his, my wife and I, we started this community organization because when you go to these lifestyle medicine meetings, there are many of them, are fabulous ones. It's usually the likes of like-minded physicians, kind of rubbing shoulders, eating predominantly a plant-based, very healthy lifestyle. And we talk a good talk, we dissect research, and we are extremely invigorated, motivated. But when you go back to the hospital to go to a cardiac catheterization laboratory, you got to go past a pizza station and a cheeseburger station. Right. So that kind of bothered me a few years ago. And we founded who is taking this message to the community? Who is taking this message to a public school? Who is taking this message to a church, a synagogue, a temple, a mosque, or a precinct, or a barber shop? And we found out there's a huge void. And so we decided to partner with some of our local community leaders and extremely passionate chefs and like-minded physicians. And we founded a nonprofit organization called PBLM, stands for Plant-Based Lifestyle Movement. We have a website, and all of our social media platforms can be, tagged or followed at myPBLM. So please look us up. And if you're in the Tampa Bay area, please let us know. We would love to partner with you. Even during the era of COVID, we want to get the word out and message out. So that being said, the main objective of our discussion today is to this PowerPoint that I put together. So my PowerPoint should somehow, I'm hopeful, that would translate into a personal commitment. Otherwise, it's pointless. So it's true that if you perceive this as a one-sided lecture, I'm hopeful that lecture would transition into a lifestyle change. Discussion today is to this PowerPoint that I put together. So my PowerPoint should somehow, I'm hopeful, that would translate into a personal commitment. Otherwise, it's pointless. So it's true that if you perceive this as a one-sided lecture, I'm hopeful that lecture would transition into a lifestyle change. Discussion today is to this PowerPoint that I put together. So my PowerPoint should somehow, I'm hopeful, that would translate into a personal commitment. Otherwise, it's pointless. So it's true that if you perceive this as a one-sided lecture, I'm hopeful that lecture would transition into a lifestyle change. Discussion today is to this. Sorry, the sound breaking. Yeah, it's Ajay, if you can hear me, I keep echoing myself from a few seconds ago. I don't know why that's happening. I don't have any other medias open. My browser is down, but I just keep echoing myself from a few minutes ago. But now it stopped. So let's continue with the presentation. So in terms of my story as to, my very presence here, if it's still, Ajay, can you hear me still?
I can hear you now. We can hear you now.
Okay, good. So there was a long pause and an echo that reverberated from a few slides prior. Don't know why that's happening, but again, sorry. In terms of my very presence here for myself and the likes of Dr. Shah and myself to spend a Saturday evening to without charging a dime to talk to the community to be healthy. It's because our life usually revolves in the deep, dark dungeons of a cardiac lead shielded room called the cardiac catheterization lab. Because by the time a fellow human being comes to me to seek help, unfortunately, it's a majority of the times it's a little too late. So it's unusual for someone like myself to make a plea to, hey guys, don't meet me there. So like Dr. Shah was saying, a few years ago at a lifestyle medicine conference, I stood up and was passionately speaking about some topic, and then these words kind of rolled out of my mouth that I have a carrot and a stick.
Alors attention, mettre mes oreilles parce que j'entends rien.
And those I wrote an essay about this. It was published by the American College of Lifestyle Medicine. It's a free access. You can Google this to kind of get a feel for why someone like myself is now changed his kind of a career paths, course directions to make people healthy. And I'm actually one of those crazy doctors who walks with a coat that actually reads that I have a carrot and a stent, you pick. I actually show it to my my patients, and one of the foundational questions is that why are we meeting here? I'm probably sure that a lot of you have better things to do than on a Saturday afternoon than hear a crazy two cardiologists. And the reason we are meeting here is that we all want to be healthy, right? That's the foundational reason. And if you really look at the concept of healthy, the word healthy can also be broken down into heal plus die, meaning that majority of our quote unquote healing is actually what we do to ourselves. And for the Indian folks in the audience, the word healthy in Sanskrit or Hindi is swast, which literally actually is a combination, is a conjugation of two words. Swa means the inner self, and sta means consciousness, self-consciousness. And quite often we don't ask this question, but World Health Organization actually defined what health is. It's not just the mere absence of disease or infirmity. Just because someone does not have a disease does not make that person necessarily healthy, because it is truly a state of complete physical, mental, and social well-being, right? So this is extremely an important concept. But we also said in the previous slide, majority of health is us, is what we do to ourselves. And this, I really like this, was from a generation ago in 1975. The idea of preventive medicine is faintly un-American. It means first recognizing that the enemy is us. Chicago Tribune wrote this in 1975, and I've been here since 1994 or 95, and it's 2020. And from a preventive standpoint of view, from a health standpoint of view, this statement still rings true. This statement still rings true. So the next and a deeper question is, why do you want to be healthy, right? I really challenge the audience to take some time after this lecture or sometime during the weekend, sit down with yourself, sit down with your family, and ask that question, deep into your soul and deep into your mind as to what is the real reason why you want to be healthy. And you'll be shocked, because I have combat veterans from Vietnam, tough men who have seen it all. When I hold their hand and ask them this simple question, quite often, a lot of people, actually grown men who have seen combat in most dangerous of places, they break down and cry as to why they want to be healthy, right? And no matter how you put these things, life, as we say in many cultures and religions, is a circle. And to answer to the question that I asked in the previous slide as to why you want to be healthy, no matter how verbose and how descriptive our answers are, almost all of our answers will fall into two broad categories. One is quality of life. We want to be healthy because we want to maintain a good quality of life. But that quality of life is also intricately related to another important question in a category, longevity. So these things are not mutually exclusive. These things are a circle. They are inclusive, right? Now, using those two criteria, using these two criteria, quality and longevity, I want to kind of take you through a graph, right? That to show that life is a box, right? We're going to draw a graph using quality and longevity and go back exactly a century ago when the life expectancy in 1920 for an average person in this country used to be 45 years, right? Most of you may find this shocking, but this is factually true. Exactly 100 years ago, an average person's life expectancy in this country was 45 years. During those 45 years, the quality of life declined very rapidly because things that we take for granted in 2020, simple things like having access to maternity care, having access to vaccination, having access to clean drinking water, having access to vaccination, having access to a primary care doctor. None of this were readily available for a majority of the society, right? So although not only did they live short lives, but during that very short life, their quality of life dwindled down very rapidly. Now you forward this to 2020, an average male is expected to live 70, 80 years. An average woman is expected to live somewhere between 82 and 83 in 2020. Now, but our life's curves looks like this, not a triangle, but a kind of a bizarre shape, right? At birth, quality of life starting slightly higher because, we have gained enormous, turf in terms of infant mortality, right? So for that reason, quality of life at birth is definitely much healthier. But what's happening starting very early, now as early as 10, 12, 15 years of age, people are becoming obese, right? People are developing hypertension. One of the most common diagnoses, to a point almost every other American has some degree of high blood pressure. Then people are developing diabetes, hyperlipidemia, which is high cholesterol, and male erectile dysfunction. Like, unbeknownst to most people, a 40-year-old American male, right? 40-year-old American male, 40% of them, 40% of 40-year-olds have male erectile dysfunction that is non-psychological, right? And then heart disease, stroke or two, chronic kidney disease, which is rapidly growing, like it's almost unseen, unheard of, exceedingly rare that we admit a patient to the hospital any given night without chronic kidney disease of some degree, and a cancer or two. And then people are living longer, but look at the risk and the disease that we accumulate along the way, starting early on, right? So we are living longer, but we are also dying longer. Kind of a powerful statement. What do you mean by dying longer? What do I mean by dying longer is that an average American loses 24 years while he or she is alive, loses 24 years due to what's called as quality adjusted loss of years. That's the second worst on the planet. The only nation that does poorer than us is Russia, where I think it's 26 years. So just imagine, and we see this in the healthcare profession, Dr. Shah and I, we see this on a daily basis, right? People are alive, but they're on 10 to 12 medications. They're constantly being hospitalized. They're constantly on drips, IV medications, dialysis. So to me, that's dying. So what we challenge through the concept of lifestyle medicine, because humanity no longer dies of two things that killed us for pretty much all of our existence, except for the past maybe 150 years. Those two diseases, two conditions were plague and famine. I use the word plague in terms of a broader category of infection, not necessarily bubonic plague, but infections and starvation were the number one and number two killer that killed humanity for as long as you can track back, except the past 150 years. So now that we pretty much conquered those two, right, we should not be dying of pretty much anything else. But yet we are dying of. So is it reasonably possible that we live a life like this, that starts with a very high quality of life, right, without accruing any of these diseases? Almost all these diseases that I lined up on the second line there, majority of them are, almost all of them are due to lifestyle diseases. And then come, let's say, arbitrarily 100 years, die short. So live long and die short. That's the concept. Live a long life and die short. And now from a triangle, we're transitioning our life into a rectangle. And this is where I kind of put my joke in, is that at the end of the day, no matter how hard we try, we are all going to end up in a rectangle. So that's the gist of my lecture, is to live life like this, with a high quality of life and as long as possible. So going back to the, again, question is that why such a burden? Why is it that almost all of us if not ourselves, but somebody within our closest circle is burdened with, if not one, two, or three common chronic diseases. Why? If I were to do this in a live lecture, I ask people to do a show of hands for this. Do you know someone with high blood pressure, diabetes, high cholesterol, coronary artery disease, autoimmune diseases, cancer, right? Dementia. So this is become a household. So we accept this as normal. It doesn't have to be, and it shouldn't be, right? So why did we get there? So it turns out there's an entire project dedicated to this called the Global Burden of Disease Project. What they've been looking at is what is the number one leading cause of this much disease, disability, and death. It turns out the diet-induced risk, the little box that I put up there, diet-induced risk is the leading cause of disease, disability, and death. And what is the actual disease it's causing is cardiovascular disease. So I think when we tell America that heart disease is the leading cause of death, not only we are lying to the public, but we are doing a huge disservice, right? What we should be telling people is that diet-induced risk is the leading cause of disease, disability, and death. It's the difference is like saying cancer, lung cancer is the cause of death. No, smoking is the cause of death, right? You see the difference? That's the way we should word it. And despite enormous gains, one of the things, if you're a diabetic and if your family member is a diabetic or somebody who you know is dealing with diabetes-related chronic kidney disease, of all the leading causes of death, one disease, despite us making enormous gain in controlling blood pressure and diabetes compared to when Dr. Shah and I were medical students, there were hardly one or two medications for high blood pressure. Now there's so many medications I can't even remember. Even if I remember some of them, I can't even pronounce, despite being an MD, right? Despite those enormous gains, diabetes-related kidney disease has jumped up 17 positions in cause of death. It's just crazy as to how this disease has crept up, right? And in terms of diet-induced risk, believe it or not, it's actually not as much what we are eating. It's actually what we are, in terms of what we are eating it's a high salt diet, which is processed food, right? Most people, because of enormous campaign, are no longer adding fistfuls of salt while they're cooking. There used to be a time when people did that, and every household had salt shakers, right? Most households no longer have a salt shaker, yet there is enormous amount of salt in our food because we are allowing somebody else to add salt to our food. And then the second, third, and fourth, literally pretty much everything else is not as much what we are eating, but what we are not eating. We're not eating enough whole fiber. We're not eating enough whole grains. We're not eating enough whole vegetables. We're not eating enough servings of fruits. And these are the leading cause of disease, disability, and death. And it's consistently shown in across the world. This is not uniquely American. This is literally across every single country. It's the same pattern, right? And despite this, despite such a clear medical data, right? Where is the society's perspective? What does the society think of all of this, right? Society, we talk a lot about war, right? But war contributes to this much death on an annual basis compared to heart disease, which is this big yellow circle. And yet people really don't talk much about this. And it clearly shows in all of our interactions. This is actually from last year, right? This is the blue bar here is the number of heart disease deaths. Yet in terms of our social media searches, in terms of our Google publications, in terms of our online publications, the blue segment of this bar graph is hardly visible, right? This is the perspective of the society. Most of our searches are about something else, not the number one killer that's killing us, right? So this is the society's perspective. How about us? How about the cardiologist perspective? Right. So this was actually studied by a colleague of mine, Dr. Monica Agarwal, and not too far from here, from University of Florida. So 930 cardiologists were surveyed, and 93% of us, close to 90% of us, reported that we received no or minimal training on nutrition. Right. So that's a foundation. So cardiologists don't receive any training. 90+% of cardiologists don't receive any formal training in nutrition. So we accepted that when we were surveyed, right? Now, the next question is that, do we feel that nutrition is important? Turns out close to 88 to 90% of us believe that nutrition is important, despite not getting formal training. The third question is that, is it your responsibility to teach this important component of disease prevention to your patients. Close to 85 to 90% of majority of cardiologists believe that yes, it is my responsibility as a physician to talk to this about patients, right? And this is where so now once we recognize the importance of it, we are not trained in it, but we also believe that it's our responsibility to talk to patients about this. Then, if that's all true, are we the change that we want to bring to this world? The answer is shockingly no, because less than a third of cardiologists admitted to eating 3 to 5 servings of fruits and vegetables a day. So we are not being the change that we want to bring to the world. And and speaking of change, 2 Nobel Prize winning doctors, and these are the doctors who won the Nobel Prize, Dr. Brown and Goldstein from UT Dallas. They won the Nobel Prize in early 90s for deciphering the mechanisms of how cholesterol and the LDL, quote unquote, I don't like using this term, bad or good cholesterol, but LDL, the molecular mechanisms, and they won the Nobel Prize for this. And what they predicted in this very famous science journal editorial is that by the end of the century may well end coronary artery disease. That's what they predicted. To make this prediction come true, the American Heart Association came up with an extremely ambitious goal that they wanted to reduce the mortality related to heart disease by 20% by 2020. Right? And to do that, they came up with very simple, they called it Life Simple 7. They created a website. Anybody in the world could go there, put up their profile and find out the good, the bad, and the ugly about themselves and their own risk of heart disease and do related modifications so the risk goes down. Beautiful project, right? Exactly a year later, the American College of Cardiology stated that to achieve that goal by 2020, the society needs to double its not primordial prevention. I'm going to introduce this word for the non-physicians in the audience. I'm sure some of you might have heard primary prevention and secondary prevention, but there's a concept the World Health Organization introduced in the 70s called primordial prevention. So this, I really like this, what American College of Cardiology said. To make this drop of 20% reduction in heart disease, the society in America has to redouble its nationwide efforts towards primordial prevention, right? But it's interesting that we're talking about this in 2020 because the last time heart disease was not the leading cause of death was before the 1918 pandemic. And during this COVID crisis, there was about 11 to 13 days during which actually COVID-related deaths per day were higher than heart disease. So due to some of the efforts, the preventative efforts and the newer medications and some messaging from lifestyle folks, heart disease was on its path to becoming the second leading cause of death almost after a century, somewhere between 2010 and 2012. But surprisingly, we missed that path, and the numbers for cardiovascular related deaths are on an uptick, and they're actually steadily going up despite all these efforts and God knows how many new medications. So the question is why? Something changed. And I strongly urge, these slides are going to be available through YouTube and other channels, but I strongly urge you to go back and read this article in the Wall Street Journal in June of last year. A 49-year-old young man, 49 years old, a hardworking guy, 2 beautiful wife and 2 young teenage girls, left them behind. And we are seeing this frequently, especially within the Indian community. This is huge, unfortunately. A lot of younger people, a lot of women, and a lot of non-smokers are now falling victim. And what's causing all of this, right? And Mr. Washington, as per this journal, has been on blood pressure medications, has been on cholesterol medications, and also worked out. So it's not like he's been neglected by the healthcare system and his cardiology folks. And yet he died at 49. And these are the pictures from the article. It's a compelling argument. I strongly urge you to read this. So this is the reason, folks. This is the reason, because now we have become a society where the combination of obesity and overweight combined is nearing almost 70%. 70%. And I want to draw your attention to the US map here. These are brand new. These are 2020 American Heart Association statistics. And actually there's an update after this. If you look at this slide, right, the checkered, this less than 20% is a checkered green dots. There's not a single county. There's not a single map. There's not a single state in the country where the obesity rates are less than 20%. In 1995, when I came to America, there was not a single state in America where the obesity was more than 20%. So this degree of transformation, where from not a single state with more than 20% to not a single state with less than 20%, actually happened between 1995 and 2020. Did we change as a species? Did somebody came and doctor our DNA from the outer space? No. What we did is that we created a mass fast food genocide in this country. Just imagine that every time we ate a cheesecake, every time we ate a pizza, we actually made it ourselves. All the fast food that we ate, because back literally a generation ago, if not 2 generations ago, our grandparents and our parents, for the most part, they cooked at home. Now we made cheesecakes and pizza and Coca-Cola available. Don't even have to go to a fancy grocery store. You can get them, all of them, for dirt cheap at a gas station mart. And that's why I use the word. I borrow that word. I don't use the word. I borrow that from Joel Furman when I say fast food genocide. And we are paying a dear price because this happened so rapidly. And this is an update to the 2020 publication from the CDC that within few months of past 2020, despite all of this messaging, you would think that obesity would go down. It actually went up by 2%. Right? How about our children? Because we do a good talk, right? We tell our children that you are our future, right? But look at our children. In every single age group, the risk factors are steadily going up. If there is one slide I want you to kind of take home from all of this discussion, that would be this. I'm going to spend some time to kind of explain as to what this is, because we really, this is an era where, science is being ridiculed. I literally despise that. We're going to spend some time to take the science, to distill it to a common person who is not scientifically oriented, who does not have an MD next to his or her name. So what this is this is a graph showing the risk factor burden, the risk factors that cause heart disease amongst our children ages 2 to 19, right? The green means good, obviously. Yellow means so-so, red means bad, right? So if you look at, there's a lot of greens. Majority of our kids are not smoking. Majority of our kids are, believe it or not, 40% of our kids are either obese or overweight, just like the rest of us. And in terms of physical activity, 75% of our children are not even meeting the physical activity guidelines. We're going to come back to this in a second in the middle, right? Close to 30% of our children have high cholesterol issues, 30% of our children, and about 15% of our children have high blood pressure, right? And believe it or not, about 13% of our children have type 2 diabetes now. It's shocking. And some of it could be type 1, but it's the amount of type 2 diabetes in American children is going up like I never imagined possible. We were never taught in medical school. Dr. Shah chime in, but we never thought of type 2 diabetes in a kid. Now, I want everybody's attention to be drawn to this middle bar graph here. A healthy diet score, a signal. So I said, remember, green means good, right? A signal for healthy diet among American children ages 2 to 19 is statistically undetectable. There is not a pixel of green in this bar graph. If this does not shock us and wake us up from this diet and self-induced coma, we will be morally bankrupt, because we are already bankrupt as in many other ways, not to mention financial part of it. So you could look at this graph and ask people like myself and Dr. Shah and say, hey, you guys are the crazy ones because you defined healthy diet as something that's unattainable. That's probably why you're failing this many American children. Is it? Is this diet unattainable? Let's take a look. This is a diet that still allows processed meat, 2 servings a week, which, by the way, is a group 1 carcinogen. This is a diet that still allows up to 450 calories of added sugar a week, right? So this is not, by any definition, this is a diet that, Dr. Shah and I would not even allow in our homes. So this is a very practical, doable diet. And yet, literally, there's not a signal detectable in our children's statistics. Because I spend some time on children, because children are a window to the world. Children literally are a window to the future. And they also, from a medical point of view, they provide us with a very unique opportunity, because when you intervene like this is what I mean by primordial prevention, meaning that why waste so much time on eating a certain way to control your blood pressure? Why not focus so much time on not developing high blood pressure in the first place? Right. So that's what we mean by primordial prevention, is that don't fight high blood pressure with lifestyle and pills. Spend time fighting never to develop high blood pressure. So that's what I meant earlier when I said primordial prevention, right? If you focus that early on, look at this very enormous amount of benefit with very little cost. As you keep on doing it later in life, the benefit keeps going down, but comes with enormous cost. That's what we do in the cardiac cath labs. And I put a line across this. If you look at the risk factor burden, this is the 20% line. Almost every single cardiovascular risk factor, meaning the conditions that lead up to heart disease and heart attacks, is at 20, almost at 20% or higher, not across the country, not across, this is just specifically to our children. This is 2019, 2018 data, and hasn't changed much in 2020. This looks identical, if not slightly worse. And as a consequence of it, because we start this as children, we have become now a society where 60% of us are burdened with at least one chronic disease that we're going to be on medications, pharmaceuticals, and procedures for the rest of our lives. And 12% of us are burdened with at least 5 or more common chronic diseases. That 12% of us, those of us who fall into this 12%, constitute 40% of America's healthcare spending. And despite spending that much, as per the 2019 Bloomberg World Healthiest Country Survey Index, sadly, America is not to be found on this list of top 20 countries, despite almost outspending most of them combined. And it's reflective of how we get paid as physicians, right? The people that get paid the least, literally at the rock bottom, and it's actually extremely important, both in context of what's going on today in the world in terms of, public health and epidemiology, and also in terms of chronic health disease prevention. Public health folks and preventive medicine doctors are literally at the bottom of the annual payment list, right? And cardiology made it to top 3 in the top 4. So this graph was drawn for China, but this is equally, if not more applicable to what we have become as a healthcare in this country, is to, our healthcare system, I cringe when I say healthcare system, because we don't have a healthcare system. What we have in America is a ridiculously expensive disease management system. That's what we have, right? And where it's sitting as an inverted pyramid on its tip. And as you all know, inverted pyramids don't last. Inverted pyramids, forget about lasting, inverted pyramids don't stand or can't stand, right? But that's what we have, ready to wobble and collapse, because we pay very little attention to public health promotion, primary care. All of our money, time, and effort goes into secondary care and tertiary care, procedures and pills. So the onus is on all of us, literally, to do anything and everything that we can do in our personal lives, in our children's lives, in our family lives, because it does take a village. Because remember, it takes 5 to make a fist, because household is a neighborhood, neighborhood is a county, county is a state, states are a country. So the onus is on all of us to literally do anything and everything that we can do to flip this pyramid, where health promotion, not a disease management, health promotion becomes the fundamental component of health management. How is that for a novel concept? So what we are doing at the VA is that we designed this, when I say we, it's a national enterprise across the VA. We have a program called Whole Health, extremely well done, where the outgoing chair of Whole Health boldly wrote in a New England Journal of Medicine article that until we design a healthcare system that proactively manages risk and promotes health for the whole person and for all people, we will continue to ineffectively deal with chronic disease and the next crisis to come along. And these words, unbelievably true. So what we call on the outside the lifestyle medicine, the VA calls it whole health, where we look at every single component in terms of diet, nutrition, sleep, literally every pillar of lifestyle medicine, with one focus and one focus only: prevention, treatment, and potentially reversal of almost all common chronic diseases. So what can we do as individuals? While systems and large healthcare systems like the VA or Kaiser Permanente are doing what they think is best, What can we do as individuals? And there's no magic pill. Dr. Shah and we are not trying to sell you a product. We're not trying to sell you a DVD. We're not trying to sell you some, concoction that he and I put together. We're trying to sell you what Mother Nature gave us. And that's what we call the 6 most important pillars of lifestyle medicine. Except for paying for our own food, every single one of them is literally free, right? We still got to pay for your food, right? Those 6 pillars of nutrition, exercise, tobacco and alcohol cessation, stress management, sleep, and healthy relationships. Right now, believe it or not, people, very bright academicians are starting up a new cardiovascular fellowships in advanced training to reduce the disease burden. What I argue is that what everybody should be, every physician should be taught and be made mandatory to be. I would even go to the extent of saying that every physician in America it should be a basic requirement to be board certified in lifestyle medicine. Because like Hippocrates said, he who does not know food, how can he know the disease of man? Right? Why do I so passionately believe in all of this as a cardiologist? Why am I arguing that every physician should be trained in lifestyle medicine? Well, let's take a look at what I do for a living. Smoking, lifestyle choice. Diabetes, for the most part, is lifestyle. Hypertension, for the most part, lifestyle. High cholesterol, for the most part, lifestyle. Put any of those 3 together, look what happens to the risk. Put all 4 of them together, look what happens to the risk of heart attack. To all of them, add obesity, which for the most part is lifestyle. Like I said when I showed the US map, right? From less than 20% to more than 20%, that did not happen because of a genetic disease that we incurred as a country. It is a lifestyle and the food that we eat. And to that, you add one of the most important components that is seldom discussed in medicine, the burden of psychosocial factors. The risk of heart attack just jumps up like crazy, right? So if you see this through graph, I kind of trying to walk you through every single risk factor and its relation to lifestyle medicine. There's an incremental gradient with every single one of them you add, the risk keeps piling up. Hence, so we're going to spend a good amount of time on nutrition here, is high cholesterol, right? And we know from some very elegant but small studies of 31 obese people, you take them and you put them on an extremely well-defined plant-based diet, every single component, every parameter of cholesterol metrics that you can measure in a laboratory have gone down literally in 4 weeks. In 4 weeks. Again, this is not an outcome study, but it's an extremely powerful message as to what can be done, right? And then we have enormous body of literature in terms of, the highest order of literature is what we call in medicine, systematic reviews and meta-analysis and of randomized controlled trials, which concluded that vegetarian diets, such diets should be a useful non-pharmacological means for high cholesterol, which is an extremely important risk factor for heart disease, right? And, data from, some of you might have heard the dietary pattern called the portfolio diet. So these diets have clearly shown, so much so they made it to the guidelines, the 2019 cholesterol lowering guidelines and the 2019 American Heart Association and American College of Cardiology prevention guidelines. They clearly tell us, if you really look at the pictures that go with these slides or with these publications, the diet component is not exclusively 100% whole food plant-based diet, but it's predominantly a plant-based diet. Right? So this is not like I'm trying to sell you something that I personally believe in. This is what the guidelines are telling us, right? In terms of inflammation. So this is a beautiful data. I'm going to summarize this in a layman's terms. So a researcher named Bonita Shah at the NYU and affiliate VA in Manhattan, they took about 100 patients with known heart disease. They took them to the cardiac cath lab. They made a diagnosis. They confirmed a diagnosis of known heart disease. What they did was they put them on 8 weeks of a healthy diet, not some junk food standard American diet, a healthy American Heart Association diet, and they then randomized it to another 50 were given 100% whole food plant-based diet. So despite that healthy to a much healthier diet, a significant drop in a marker that we use called C-reactive protein for inflammation has gone down by an additional 38% in 8 weeks, right? And there's another new molecule called trimethylamine oxide, TMAO. Some of you may have heard of it, a lot of chatter on this in the scientific literature, and also I see some stuff about this in social media. But what it is that animal-based choline products, especially such as cheese and eggs, the liver converts them into a new molecule called TMAO, which actually has been shown. I just want to caution you, the jury on this from a purely scientific point of view is not quite out yet. There's some conflicting data, but this is actually coming out as a newer marker, which uniquely happens with animal-based choline products get converted into TMAO in the liver, which causes, has been shown to increase mortality. I'm going to spend some time on hypertension, which is high blood pressure, because almost every other person, if not every third person, has high blood pressure across the world. This is the most commonly diagnosed medical condition, or that we treat for hypertension, I think, in addition to depression, right? So some of you might have heard the term benign essential hypertension. I'm going to give you a little trivia here, right? What is so benign and what is so essential? Believe it or not, till this day, almost all American electronic medical records label hypertension or high blood pressure as benign essential hypertension, a disease that we call the silent killer. What is so benign and what is so essential? So Paul Dudley White in 1937, a man who is regarded as the father of American cardiology, felt that hypertension may be an important compensatory mechanism which should not be tampered with, even if it were certain that we could control it. So they believed back then in the 30s that this disease should not be treated. This is a natural history of how nature takes care of the body, that as you get older, you need higher pressure. So much so, Paul Dudley White and some of his team members were treating none other than President FDR. So the day he had a massive stroke that led to his demise, his blood pressure, I'm not mincing words here, not 203, his top systolic blood pressure was 306, because they felt they should not be treated. And a friend of Dr. White from England, and he felt that the greatest danger to a man with high blood pressure lies in its discovery, because some fool is certain to try to reduce it. So physicians actually did not believe in treating high blood pressure in the 30s and early 40s. The people who actually believed in, almost a generation before them, were the insurance companies. They actually published literature that the blood pressure machine is one of the most indispensable tool in life insurance examinations. And they actually pumped a lot of money into using this as an appropriate tool. So the reason I gave you a little bit of a historic perspective here is to, as a segue into this slide here, which is, let's say all of us are at 45 years old without any high blood pressure, and we live in this country, and we live to be 80 plus, right? Our risk of having diagnosed with high blood pressure during that lifetime is anywhere between 84 to 93% guarantee that we will end up actually having high blood pressure during the next 40 years, if you're 45 today. So does it mean that that's the natural history? That's what happens to human beings, and that's what we are made up of? Because it's happening to 93% of us. Is that true? Turns out we have known this to be not true from as far back as 1929. Right, where people studied sub-Saharan Africans or rural Chinese. And what they found was that as you aged, your blood pressure actually went down. Right, so was true in Western China. So now you fast forward from 1920s into 1940s, came a man named Walter Kempner, who was arguing with American physicians, hey guys, this disease that you're treating is not due to some kind of a bizarre toxin the kidney is releasing, but it is because the food that we are eating. And none of his contemporaries would actually believe in him, except Duke, which gave him a lot of funding and built a huge building called the Duke Rice House, which I believe is still operational. So this is before the invention of any of the contemporary blood pressure machines. So he would take patients with like this, markedly enlarged chest, heart is dilated, is enlarged due to uncontrolled blood pressure. The EKG shows a lot of what we call voltage, meaning it's the basic electric signal showing that the heart is thickening. Eye should be all bleeding inside the eye, all fluffy eyes like this. He would take these patients and put them on nothing but a pure boiled rice and starch and vegetable diet. And he had a couple of protocols, like a few weeks to a couple of months protocol. And he would re-image them to show not only did the blood pressure number go down, the organ damage actually reversed. When he wanted to publish this in the 40s, actually a lot of American journals would actually refuse to publish this data. They thought that he was some kind of a con artist. So almost like with a tone of respect and an apology, people have been publishing, his work again, basically asking the question, who was Walter Kempner? So this data is not new. Now, subsequently, we started seeing publications 10, 15, 20 years after Kempner that, from Boston area, that, hey, it turns out vegetarians, right, people who ate predominantly unprocessed plant-based diet were having the lower blood pressures. So what's going on here, right? Turns out, and they led to an important trial called the DASH trial. So this is I want everybody to kind of take a look at this. So when these researchers went to National Institute of Health and said, hey guys, we want to do this research, and they said, we want to design a diet. The diet design goals were to create a pattern that would have the blood pressure lowering benefits that of a vegetarian diet, right? If you look at it, why can't you just tell people to eat a vegetarian diet, right? But instead they chose to do this. So again, the DASH trial, if you're interested, this is a fascinating trial that tried 3 different patterns of eating, and clearly concluded that a diet that is predominantly plant-based, they did include some animal products because the researchers felt that 100% plant-based diet may not be quote unquote palatable to a larger American society. When they did that, they clearly showed that a combination diet was so useful that it made it to the guidelines as a class 1 indication, meaning that we have to support this. We have to suggest this to our patients. Believe it or not, if I were to invent a new blood pressure machine, all that I need is to show that your blood pressure dropped 3 millimeters, 3-point drop in with my pill. As long as I show it's safe, will be approved by the FDA. In terms of DASH diet and 100% plant-based diet, the diet alone can drop your blood pressure anywhere between 11 to 26 points without a need of any medication. Yet, we don't talk much about this. And because of these reasons, eating a DASH diet, which is predominantly a plant-based diet with low sodium and high dietary potassium, which is basically not taking potassium capsules and crazy pills, but fruits and vegetables. So before we go into diabetes, I think what Dr. Shah and I agreed is that we will pause here for a few minutes so he would break down or summarize what we discussed so far, and then we go on to the second half.
That's an excellent summary and presentation to start in our next stage. But let me tell you from my own personal experience. As a cardiologist, I always believed in prevention, but most of my prevention was done in a secondary prevention with statins. Once I became lifestyle medicine board certified, I realized that there is just so much more power to lifestyle changes. And whenever I talk to many of my colleagues and even some of the patients, they said the lifestyle changes at times are difficult and at times are not possible. But we have data, even from Din Ornish from 90s, that lifestyle changes are not only easy to do, but matter of fact, people who do lifestyle changes, they start to enjoy those changes so much in their life. Because when I prescribe a medicine, Lipitor, for example, for cholesterol, it doesn't do anything but lower the cholesterol. It doesn't improve their sleep. It doesn't improve their mood. It doesn't lower their weight. It doesn't improve their sexual erectile dysfunction. But when you start changing lifestyle, all those things improve and many more. So people actually start to like the lifestyle. And from my own personal experience, every patient I have prescribed lifestyle medicine have come back and has thanked me a million times more than when I prescribed them medications for last 25 years. So when people say lifestyle changes are difficult, in my opinion, doctors just have not prescribed them. So we need to change doctor mindset. Unfortunately, like Dr. Reddy said, many doctors don't get enough training. Many doctors don't have enough time within their 15 minutes. Many doctors don't get paid for doing the lifestyle changes. So our healthcare system or sick care system has unfortunately wrong priorities. We need to start reimbursing primary care physicians and lifestyle physicians for the time they put in as much as an interventional or a surgical person doing any procedures. In my opinion, when we do a stent, it may temporize the problem with heart attack or any kind of life-threatening situation. But our care should not end there. I think our care should be taken over by a lifestyle physician, by a primary care physician who believes in lifestyle medicine, and by a cardiologist who believes in lifestyle medicine, to continue taking care of that person for next 20, 30 years, so that person never have to come back to the stent or bypass type procedure. And this is all doable. And Dr. Reddy is doing it. I think sometimes I used to think that patients at VA hospital, many of them have many socioeconomic issues. But if Dr. Reddy can do it in a VA population, I'm pretty much certain that can be applied not just to America, but the whole world. Other thing I also believe that many developing countries cannot afford what as American we can afford those stents and bypass and many other surgical procedures. So these lifestyle changes are not just needed in America, they are more so needed across the world, particularly in India. So I think to me, this leadership by Dr. Reddy, not just in cardiology, but at the American College of Lifestyle Medicine, was badly needed for last many decades. And one would think that heart disease being number one for last 100 years, we would have learned something from it, but we have not learned. So I think we have a large task on our hand. I'm doing my part, Dr. Reddy is doing my part. Everybody participating in Zoom is ready and excited to take this project in our hand, make every contribution we can make, every day work hard, and make the whole trajectory for next 10, 20, 30 years. Our life expectancy has gone down for last 3 years. I think we can make a major change. It will require a lot of efforts. We need to be strong on science and evidence-based side. We need to be strong on a social media side. Like we talked in our last Zoom call that when a consumer demands a lifestyle change, doctor will have no choice but to offer the lifestyle change. So we need to do a grassroots movement where we actually make a consumer aware of all lifestyle changes options available. And if we can create the grassroots movement, eventually we will change the healthcare system. So let's listen to Dr. Reddy for the second part, and we will have some Q&A after that. Thank you, Dr. Reddy. Please go ahead.
Absolutely. Thank you, Dr. Shah. And yeah, completely agree with your logic and philosophy there. So going on with the risk factors, as most of you know, type 2 diabetes is not just a risk factor that, for many years now, we believe that it is a risk equivalent, meaning that the way we treat someone with type 2 diabetes, we pretty much assume for all practical purposes, whether proven or unproven, that you have heart disease. That's how we treat a type 2 diabetic. Even if they don't have heart disease, their risk of having a heart disease and dying from it is so high that it's just as high as someone who has established heart disease. And that's what risk equivalency means. And we now know that. I mean, we can do an entire presentation on diabetes, but Dr. Shah and Dr. Gulati did an excellent job a few weeks ago on this topic. But where we stand as of 2019 and 2020, based on some landmark research, is that, and that got into the consensus both by the American Diabetes Association and the American Association of Clinical Endocrinology, where the prevention is the focus. In terms of the dietary component, this is the 2019 American Diabetes Association guidelines, where they support Mediterranean, vegetarian, Ornish, Pritikin, and interestingly, they included paleo and low carb diets this year. As to why they did it, that's another entirely a different discussion and an academic debate. Today is not the forum for that. But if you look at it, including DASH, majority of the approved, scientifically supported, and in terms of Ornish and Pritikin, those are the only two that are supported by the insurance companies and CMS, are predominantly or exclusively plant-based diets. And a sister organization in the world of diabetes and endocrinology, the American Association of Clinical Endocrinology, their 2018, 2019, and 2020 consensus report in terms of preventing, treating, and potentially reversing diabetes clearly state that lifestyle therapy begins with nutrition. And they go out and even say that all patients should strive for primarily a plant-based meal plan. This is the American Association of Clinical Endocrinology, right? So this is where the science is. So this is not something that we're trying to sell you as some snake oil salesmanship. These are official guidelines. And this is their 2020 paper, and in the American Association of Clinical Endocrinology, they clearly state the same thing, is to eat predominantly a plant-based diet. So if you do this, right, we kind of talked about high cholesterol, we talked about diabetes, we talked about uh, high blood pressure. So if you do this, if you control these things, can heart disease not only be prevented, but can it be reversed, right? But let's go back to the prevalence. How much heart disease do we actually have, right? So this is an old paper, old in the terms of it's used to be a sad state of affairs that a medical journal, a prestigious medical journal back then allowed, words that we, the N word to describe the racial, profiles in, health care and diseases. But that's how medical literature was published, believe it or not. But back then, what they did was they compared autopsies of 1,427 patients from Africa and compared them to St. Louis. Turned out that in St. Louis, almost everybody had some degree of visible plaque that either remained stable or led to a heart attack, as opposed to people from Uganda, just one person had a tiny plaque. So that's the natural history of disease in the 60s. And unfortunately, now it's not true because we have succeeded in America to export the standard American diet or similar patterns pretty much literally across the world, even in some rural areas with some exceptions. So what Dr. Shah was alluding to a few minutes ago was this famous trial. And he and I often wonder, up until recently, this paper was published in 1998, right? Why did we not talk about this during cardiology grand rounds? Why was this never presented during our journal clubs? Small paper, but extremely thought-provoking, extremely well done. Clearly showed that over a very short period of time, 91% of patients become angina-free. People stop having chest pain without popping 4 medications for it, right? Not only that, this was the first trial that actually showed, but based on an angiogram, the plaque inside of a blood vessel can actually be reversed and be regressed using nothing but lifestyle changes, using a low-fat vegetarian diet predominantly. And this is another fascinating paper. Some of you, if you're in plant-based lifestyle circles, know this data by Dr. Esselstyn. He took 198 consecutive patients with established heart disease. These are 198 patients with known heart disease, and they're all non-smokers. And what he did was that they have to be on 100% completely a plant-based diet, no animal products. Very strict way of eating, actually. It's doable, but most of us may perceive it as strict. No oils, no avocados, not even the quote unquote healthy plant-based fats, and eliminate all processed carbohydrates and all processed sugar. It is strict because these are people with established severe heart disease. This is not a preventive strategy with these are people with severe heart disease to begin with. Of the 198 patients, 177 were adherent. They stuck with the program. And this is an example of such a program of a man who also happens to be a physician at the same program in Cleveland Clinic, where they clearly showed reversal of heart disease on a stress test or on an angiogram, right? If somebody showed this to me 10, 15 years ago, I would have not believed this, right? And this making a picture look beautiful like this in the corner in the cath lab is one thing. What really matters is that when you change your diet, when you change your lifestyle, so in terms of lowering risk, did you have less events? Did you have less strokes? Did you have less heart attacks? That's the only thing that really matters to a patient or any one of us, right? Who really cares about what it looks like on a picture? Is my risk of heart attack lower? So to put that in perspective, of the 177 patients who were adherent to Dr. Esselstyn's diet, only one patient had a stroke. So the event rate was 0.6%. Amongst the 21 patients who joined the program but were not adherent to the diet, the event rate was 64%. Because remember, these were high-risk patients to begin with. So how does this compare? Meaning that I challenge my colleagues. Yes, this is not what we call the randomized controlled trial in medicine, but can anyone, I actually challenge the world of cardiology, that can someone, anybody in the world of cardiology, can you take 177 patients with established severe coronary disease and follow them for 4 years and show me the event rate as 0.6%. Because in all the trials that we use, the event rate is somewhere between 15 to 20%, right? But with significant dietary changes, the event rate can be less than 1%. That is how we treat heart disease, not meeting me in the cardiac cath lab. Another trial, beautifully done trial, doesn't get the press or the respect it deserves. I don't know why, but this is from a small mountain town in India called the Mount Abu Open Heart Trial. It's actually extremely well done. They use the concept of healthy as in heal and thyself. And they define, these are actually the words verbatim from the trial. And they use the multidisciplinary approach of a psychologist, a meditation person, a dietitian, a person who taught the patients exercise. And these are all, again, patients with known heart disease. And they studied 360 blockages, and they clearly showed that close to 91% of patients had a significant regression, reversal of blockages. And this same research group is coming up with a major, much bigger trial. It should be out any day now, right? So in my world of cardiology, there is pretty much fairly convincing data that the disease that I make a living out of, one, should not exist. Even if it exists, people should not be dying from it. So to get there, depending on where we are on the spectrum, what do we actually eat? Right? So this is a beautiful paper from, this is a beautiful publication from Canada, right? Unlike our plate, Canadian plate actually shows some food on it, right? If you look at it carefully, this is not a vegan or a vegetarian plate, but if we can get most people to eat like this, right? So just because I'm a 100% plant-based eater, my mission is not to make everybody some kind of a crazy hippie vegan or something like that. Diet is a spectrum. We want you to move towards the healthier way of eating. Right? So in that spectrum, the Canadian diet, if you look at the guidelines here, picture, this one picture tells the 1,000-page guideline, I should say, summarizes pretty much. It does include some animal products, but if you look at it, close to 80-90% of the calories are coming from wholesome plant-based foods. And what a novel idea. They're asking us to drink water, right? What a human concept, right? But here, hopefully this will change this year because the 2020 guidelines should be coming, and maybe they'll be delayed due to COVID, but they should be coming out. What we tell Americans is to eat some vegetables, right? When I say vegetables, everybody knows what a vegetable is, whether you like them or not, right? Same thing with fruits. When I say fruits, you know what fruits are. When I say grains, whether you may hate them, but you know what grains are. They not only support human life, they support many other life forms. But cleverly, they included protein. When I say protein, majority of America thinks it is some type of an animal flesh or dairy or cheese. Why? Protein is a molecule, right? So it's a very clever way, right? But if you look at it, protein, so in the top right corner here, the Canadian plate, when you say protein, they show you beans, they show you lentils, they show you whole, right? Other stuff that they show you tofu, right? So protein and also dairy products. Right? Where is the science? Where is the science to tell every American through myplate.gov, through federal support, that every American should drink a cup of dairy with every single meal? Right? This should be replaced with water. Right? So we wrote some papers, and we wrote some plea and submitted to USDA as far back as 2018 in preparation for the 2020 guidelines. And we're hopeful that they don't fall on deaf ears, right? So, to summarize all of, Dr. Furman calls this the nutrition equivalency of Einstein's equation, meaning that an equation that is, when written on pen on a piece of paper, is less than an inch long, but explains all of, everything, like E is equal to MC square. So where health, right? We're not talking about, weight loss. We're not talking about some fad diets. Where focus is health. Your health is equal to the nutrient density of the food and is inversely related to the caloric density of food. Means that eat foods that are very high in nutrient density and very low in caloric density. And this picture does justice to that. And some of you might have seen this, is that, let's say it's dinner time or lunchtime, and my focus is to get 500 calories. If calories are the only focus, why not go into a pantry and drink 4 spoons of olive oil or 5 spoons of olive oil? I got my 500 calories, right? So that's why, everybody's going calorie counting. So the food also should be calorically rich, right? But meaning that you should get your adequate calories, but at the same time, you should get your nutrition also. But then someone may say, well, you know what, Dr. Reddy and Dr. Shah, I take olive oil because olive oil is rich with some kind of antioxidant. Yes, it does have some antioxidant, but look at the caloric burden, right? So drinking olive oil or eating olive oil for some antioxidant, in my mind, is analogous to, is similar to drinking Coca-Cola so you could get your daily potassium. Yeah, will you get some potassium by drinking Coca-Cola? You bet you will. But is that the best source? So if you use that logic and go down this chain of, stomachs full of food or partially full of food, the food that gives you to get 400, 500 calories in terms of vegetables, lentils, and beans and plant-based foods, you'll really have to. That's why one of the things that we enjoy in plant-based community and whole food plant-based people, we eat a lot of food, right? Because and we enjoy doing it. But the world thinks that we eat like this, right? The world thinks that we eat foods like this, quite contrary, using these very simple 6 ingredients, fresh vegetables, lentils, beans, greens, and we make foods like this at home, right? Our plates, we have actually a whole bunch of groups on social media where we share our pictures on a daily basis, and our foods look like this, right? And this concept, pharmacy, is this a new concept? Am I inventing this for the first time? No. People have been saying this for centuries, if not millennia, that food, and the food choices that we make, it should be the primary focus of disease prevention, right? So one of the words that I seldom use in my presentations is the vegetarian or the vegan words. And I completely have enormous respect and support, and I'm full on board with the vegan concept. But when we say the word vegan, it only carries the message that what I don't eat, right? If I sit here in front of all of you and say I'm a vegan, all that you hear is that, oh, this guy does not eat animal products for whatever reasons he believes in. But who cares about what I don't eat, right? The only thing that matters is what I eat, meaning that I could say to all of you that I'm a vegan, but when you press me and ask me, what do I actually eat? I'll tell you, oh my God, most of my calories come from French fries, Oreo cookies, and then to wash them down, I drink soda. And the new thing that a lot of people are using, this Beyond Meat and Impossible Burger. Look, if you want to go out and eat them as a, for environmental reasons, as a transition food to, because you're so hooked on to eating that meaty burger type of a feel, it's not my place to judge you or to lecture you otherwise. But eat foods; these are processed foods. If you really look at the amount of saturated fat in some of these new generation meat alternatives, it's pretty high. So there's this beautiful paper by Dr. Satija and her group that clearly showed that processed plant-based food is just as dangerous, if not sometimes more dangerous, than actually eating some of the animal products. So just because something is vegan, this is an extremely important message I want to send across. It's just because something is vegan, it's not healthy, right? You may be doing it. If you're doing it for animal rights issues, again, it's not my place to, again, judge you or lecture to you. But from a purely human health point of view, there is a clear gradient in terms of what real food is, right? To summarize as to what all of this message is, that no matter how much I read, Dr. Shah, I'm willing to bet he would agree with me when it comes to the nutrition component, is that no much how much he and I read, this one sentence by Mike Pollan summarizes all of nutrition science, is that eat food. And what he means by eat food is that eat real food, not too much, mostly plants. And someone like myself, I took it even a step further. Instead of mostly, I chose to do exclusively plants, and it's been working extremely well for myself and most of my patients. So that's it. When I say that, I picked this extreme, and I suggest this to quote unquote extreme. And this is actually one of my plates. This is a breakfast, I eat, fairly commonly. And I show this picture to my patients and say, look, we want you to eat like this and see what happens in 6 months. And they say, this is extreme. Then I show them this picture, right? Meet me someplace, right? How about this for extreme, right? So why get ill in my cath lab when you can get well in your kitchen, right? So other pillars of lifestyle medicine, we're going to briefly touch upon this, but because Dr. Shah will, I'm sure he will bring experts in their respective areas. But sleep is an extremely important thing. Gandhi said this actually, that each night when I go to sleep, I die. And the next morning when I wake up, I'm reborn. That's literally 7 to 8 hours, right? And in the interest of time, we're not going to spend too much time on other pillars of lifestyle medicine, but I want to clearly show you the science behind this. Somewhere between 7 to 8 hours is when you have the least kind of all-cause mortality, death due to any reasons, cardiovascular mortality, right? Stroke risk. Same thing with diabetes. Like sleep is an extremely, extremely, extremely important point. Most doctors, you'll be surprised how many patients come back and say, hey, my primary care doctor never talked to me about sleep, right? Extremely important component. Same is with diabetes, 7 to 8 hours. People, especially if you're a sleep apnea patient, and a diabetic, you probably remember the day when you started using your sleep apnea machine, the amount of daily insulin that you take actually goes down because now you're sleeping better, right? And also, there's not a completely conclusive evidence, but people who do night shifts, right? Prolonged many years of night shift work is considered as a carcinogen, meaning that but again, night shift work also comes with many other behaviors, people who smoke, people, again, not trying to blame anybody or shame anyone because it's just the society, because somebody got to do the night shift. We did as doctors, we still do. The second one is physical activity. My simple message with physical activity, if you can move something in your body, move it as frequently and as long as you can, right? And it turns out that you really don't have to become some kind of a marathoner to run it, or spend about 53 miles walking on your 53rd birthday like Dr. Shah did. But most of the benefit actually happens within the first 15 to 20 minutes of walking. Just simple cardio or anything that you can do, because that's what you see. The most of the drop, right, in risk actually happens within the first 15 to 20 minutes. After that, it kind of plateaus. So 15 to 20 minutes, literally. And then you can, ideally the recommendation is to do at least 30 to 45 minutes for literally all days of the week. And smoking. You may ask me, well, come on, do I really need to talk about smoking in 2020? Well, I need to, because a lot of people are still smoking, and it was not too long ago, right? 5 years before I came to America, 5 years before I came to America, there was a raging debate in this country whether we should allow or ban smoking on a commercial flight. 1990, February 25th was the first time that we banned smoking on passenger airlines. So that's not that long ago. So, and like most of you know, smoking is bad from literally head to toe, right? And I really don't need to go into this. So please, not just smoking, but avoid all forms of tobacco. Alcohol. Every single time we say alcohol, people come up with moderation is okay. Well, tell me what is moderation, right? People, because tell me what's moderation, because if you go and ask people, students, age 18 to 24, how about this, age 65 and older, close to 4% of people who are 65 or older, right? Let's say majority of people, somewhere in the prime of their youth, quote unquote, somewhere between 18 to 45, anywhere between 12 to 25% of people admitted to binge drinking in the past 30 days. So now you tell me what moderation is. Yes, the guidelines tell you for women 1 drink, for men not to exceed 2 drinks. These are extremely arbitrary numbers because turns out alcohol is listed as a group 1 carcinogen, meaning that alcohol itself is a group, it causes cancer by itself. Why would we tell the society to drink in moderation? Right? So speaking of group 1 carcinogens, the most recent addition to group 1 carcinogen list is processed meat, right? Another message to anybody who's hearing this type of a discussion for the first time, if there is one dietary pattern that you want to take home after tonight, if one dietary pattern that I strongly urge and implore you to give up is the consumption of processed meats. Because processed meats are now belong in a group 1 carcinogen list. Right, then you may ask me, well, if that is true, why is every grocery store in America selling them in a deli meat section? Well, why is America also selling cigarettes inside of a pharmacy like Walgreens? Right? Why are we one of the only few countries that sells alcohol at a gas station? right? So that's another complete discussion. But as to where the International Academy of Research for Cancer and almost every cancer society on the planet is aligned with is this message. These processed meats are group 1 carcinogens. Please avoid consuming them, right? But once you build into a pattern, right, a healthy eating pattern. So we have to stick to a pattern. This is not a fad we are trying to sell you. You have to stick to a pattern and stick with it for as long as you can. And that pattern includes predominantly large portions of dark green leafy vegetables, fruits, lentils, and whole grains, and completely eliminating processed meats, significantly minimizing to eliminating red meats, and all kinds of animal products for that matter. And sugar, extremely important, underappreciated. People don't talk much about this. Well, people do, but really don't put into practice. Is sugar. I mean, an average American eats pretty much his or her weight in pounds of sugar a year, right? So that you got to be extremely careful because everything that we eat in a processed section is somehow tainted with large quantities of sugar. So I do all of this, and then I'm sure every one of you, if you're a physician, if not an average person, we all heard this, that you hear a lecture like this, and I do because I hear this from my patients. People say, Doc, the disease runs in my family. There's nothing I can do. This damn disease runs in my family. So it turns out in 2017, the president of American Heart Association, at the American Heart Association annual meeting in Anaheim, California, while on the floor of the AHA annual meeting, right, had a massive heart attack and almost had a near sudden cardiac death. So luckily for him and his family and the world of cardiology, he was in the confines of some of the brightest minds and adequate systems. He was revived, shocked a couple of times, I believe, and was taken to a nearby hospital and underwent an emergency heart catheterization, something that I do for a living, and was found to have 2 blockages or 2 stents put into what we call the widowmaker, or the left anterior descending artery. So soon after that, he recovered, and he continued with his lecture and message where he said, there are no old men in my family. All branches of my family tree have been cut short by cardiovascular disease. I believe the people in this room have the power and even the duty to change that. That year, I did not attend the American Heart Association meeting, but by virtue of being a cardiologist, I am one of those people in that room, right? So Dr. Warner is imploring us that the power and the duty that we change that, men and like myself and cardiologists, right? But turns out that we actually have an interesting tool to change the genetic risk. That we can do blood tests on people and quantify their genetic risk, meaning that I can do a blood test on you, study for certain genes, come up with a polygenic risk score, and tell you what is your risk of having a heart attack or a stroke, right? And let's say I do that test and say all of you are at a very high risk. All of you are at a very high risk. But we want you to do certain things. We want you to never use tobacco and maintain a BMI of less than 30, not like 23 and 24, Dr. Shah and I preach, just 30. So very reasonable definition. Physical activity of at least 35 to 40 minutes once a week, just once a week, folks, and a healthy diet, not some utopian, crazy vegan diet, but strict adherence to at least half of what American Heart Association is asking us to eat. So this definition by no means a crazy, unattainable definition. Even if you did this mediocre definition halfway through, even in the setting of high genetic risk, your event rate can be cut down by 50 to 60%. I want to repeat that. Even in the setting of high cardiovascular genetic risk, if you do 4 or 5 simple things of not smoking, you can still be slightly obese, right? And be very minimally physically active, but eat halfway through what is called as a healthy diet, your risk can be lowered by 50%. So that's my argument. I know I look at this slide and I tell people that it's dinner stupid, not DNA. And I even go on to sometimes say that even if our fate is written in our genetic code, be known that it is written in pencil. We have been given an opportunity for the most part. I'm not talking about rare conditions like monogenic conditions, what we call them, like cystic fibrosis or Down syndrome, that kind of stuff. If you do those things, if you do those 4 things, your lifetime risk of diabetes can go down by 93%. Your lifetime risk of having a heart attack go down by 81%. Your lifetime risk of stroke by 51% and cancer by 36%. And I don't have the 5th one here, all chronic diseases by 78%. I actually have printed this into a large poster and I displayed in my office for every medical student, resident, fellow, and colleagues to see that. Show me something like this in contemporary cardiovascular medicine or any medicine through pharmaceuticals and procedures that offers this. Nothing. So hence, healthy living is the best revenge, right? So putting it all together, right, to inform everybody about this message and inspire, hopefully I am able to inform and inspire some of you. I find this to be the easy part, to put together a slideshow like this, and after doing a few talks, come across and sound like an expert is the easy part. But the most difficult part is how do you, on the receiving end, make this deeply personal and very practical. Unless that happens, folks, our efforts are going to go waste. So you have to find that personal and practical reasons, and goes back to the very first question I asked all of you: why do you want to be healthy? Right? To be able to do that, to be able to make it personal and practical, the first question is to be mindful. Mindful of the answer that rings in your heart and rings in your soul when you ask that question as to why you want to be healthy, right? Be aware of reasons. And when I say mindfulness, I'm not asking you to go home and send me a picture next week of you walking around with a rosary and a halo behind your head. That's not what I'm asking you. What I'm asking you about being mindful is to be acutely aware of your personal reasons and the choices that you make. To do that, one, we want you to assume a beginner's mind, like Dr. Shah and I did after God knows how many years of cardiovascular medicine training and thousands of procedures between the two of us. When we were hit with lifestyle medicine, we had no clue. When we are hit with life on a whole food plant-based nutrition, we had no clue. What did we do? We assumed a beginner's mind, said to ourselves that we don't know anything about this. Absolutely nothing. We started with a clean slate as an open book and non-judgmental. Don't judge the messenger. Don't judge yourself. Just let the information come in, take time, do your own research, and be patient. Be patient and be accepting of failures, right? And adapt a non-striving attitude. This is not a competition to compete with someone. But if you really want to look at it as a competition, look at it as a competition to bring out the best you out of yourself. And trust yourself. Trust yourself. Trust some authority, because they have spent a lifetime putting material together and research together. And if you fail, let it go and start all over again. So this, to me, is the concept of mindfulness. Not necessarily, I'm not trying to belittle the concept, the physical practice of mindfulness with, sitting and, kind of let your mind clear. But out of that clearing the mind has to come this circle of thoughts as to how do you put, unless this happens, none of this lecture is going to become deeply personal and practical to you. And be very curious. Be very curious, and because that curiosity is a powerful thing. And try not to let your assumptions, just because you assume something, don't let it become the permanent truth, right? And have an open mind, and at all times stay grounded in all of your approach, especially with lifestyle. Because if I'm going to ask you to change 20, 30, 40 years worth of lifestyle, you have to buy into this way of thinking. And when you do it, be extremely flexible. Right? Be extremely flexible, because at the end of the day, we are all human. We are going to fail at some of these things, and make it a fun process. Invest some time, invest reading, and gradually build on brick by brick, day by day, meal by meal, workout by workout, meditation by meditation, gradually build it. And then be optimistic, because it turns out people who live life with a sense of optimism tend to live longer. Data is there, impressive. And people who also live lives with a sense of purpose also tend to have less events and higher survival chances. And stress, again, this is another entire lecture. I'm sure Dr. Shah will bring somebody to through his lecture series about stress management expertise. And I'm still in the very stages of learning about this myself, because we don't get taught of how to do this in conventional cardiology. But stress is related to almost all chronic diseases. So much so that life lived with sense of social anger and hostility puts you at just about the same risk for heart disease as smoking, right? And the reason I chose to call this title "An Issue That Can No Longer Wait" is based on an interesting series of papers that were published in the most prestigious cardiovascular journal, the American Journal of American Cardiology in 2018, where it states that this undertaking will present a challenge. The undertaking in like what I'm doing, what Dr. Shah is doing, and for the journal was publishing this series of papers. This undertaking will present a challenge for the journal. While the traditional treatment-focused content will always have a presence, we recognize that this is the direction that cardiovascular clinicians need to take, more holistically treat their patients, and potentially drive down the global rates of cardiovascular disease, because we can no longer wait at the expense of our patients. Not my words, by probably the most influential cardiologist on the planet currently alive, Dr. Valentin Fustel. So that's my message. If you're a physician or an allied healthcare professional, please look us up, lifestylemedicine.org, American College of Lifestyle Medicine. If you're a professional in the field, we offer a board exam. This year, for obvious reasons, the meeting is going to be virtual. Myself and a few other colleagues, it's going to be fantastic 3-4 day symposium, so please join us. And I will stop here and let Dr. Shah take over, and I will follow his guidance.
No, thank you, Dr. Reddy. This was probably one of the most elegant presentation. I've been listening to lifestyle presentation for the last 3 years. This was most evidence-based, most practical, and most direct, in my opinion, most direct a message to the whole medical community and every person who takes care of the people and the patients, that we need to wake up as provider, whether you are a doctor, whether you are a nurse practitioner, whether you are a lifestyle coach. This is a big wake-up call. So this lecture presentation will be watched again and again. And again, to repeat myself, many times I've said that when I was prescribing that Lipitor, I did not make any bond with any patient. It took me 1 second to write it. Patient was in and out. Now, when I sit down, just like Dr. Reddy does, sit down with the patient and talk about nutrition, talk about sleep, talk about lifestyle, they actually almost start to become my friend. And that has led to actually much more joy in my life. And I've seen many physicians burn out practicing good old medicine, which they've been taught in the medical school year after year. And after many years, they actually burn out. I think I actually challenge that when physicians and providers start practicing lifestyle medicine, they will have much less chance of burnout and much more relation with the patient like a friend. So that was definitely a big eye-opener that I'm learning myself, that how can I be friend with patients and people instead of just a provider. Second thing, like Dr. Reddy said, our body is a wonderful machine. If we even employ 90% of what Dr. Reddy taught us, we will live up to 100. We will live up to 100. So we don't have to go 100% everything what has been recommended in lifestyle medicine. Even if you make 90% success, we will be great. And the third thing, which many times people said that America is a very fast-paced country. There are a lot of industry influence. How can we change in America? That's not true. We have a blue zone in America. If you look at the Loma Linda Seventh-day Adventists, they are doing what Dr. Reddy taught us every day. So if those Americans can do it, every American can do it. And those Seventh-day Adventist people live actually 10 years longer than an average American. Not only they live 10 years longer, the last 10 years are one of the most healthful years. They drive up to 90, 95. They are gardening at 90, 95. So we have a living population right in America, what Dr. Reddy wants us to do it. So I think my challenge to all our 50 Zoom participants, most of them are physicians, and to every of my colleague, every physician, every nurse practitioner, let's take this message from Dr. Reddy. Let's educate ourselves. Let's be a friend to all of our patients and teach them how to change lifestyle instead of just keep prescribing medication year after year and keep doing procedures year after year. Not only we will gain the trust much bigger than prescribing medicine, not only we will become their friends, but they will actually thank us 10, 15, 20 years down the road when there is a lot less suffering, a lot less healthcare costs, and a lot longer living. So I think what Dr. Reddy taught us is absolutely, absolutely must if you want to go forward as a country. We cannot afford this sick care. We need to change that. So I'm going to keep bringing Dr. Reddy every few months. He's going to bring new information, but he's going to keep teaching us how to be a better healthcare provider. And I'm absolutely thankful to Dr. Reddy. This was probably one of the best live we had in the last 6 months. But at the same time, I asked every participant, both on Facebook and on Zoom, that please look at our page. Our page is intended to create a grassroots movement. We take everybody, including physicians, nurse practitioners, PAs, we take everybody, including every person, as an equal team member in this healthy lifestyle movement. I bring same amount of information and value on the table as my patient brings, because if a patient changes the lifestyle, he or she can be a bigger teacher than even many doctors can do. So I take all of you as an equal team member in this healthy lifestyle team. So look at our page, share this page with your patients, with your friends and family. Join Dr. Reddy, join me in this great movement. And again, I invite all of you to some questions. We will have another half an hour to take questions and answers. So please stay online. Let me ask the first question to Dr. Reddy, which has been on our Facebook page, that if a person wants to change the lifestyle, can they do it gradual way instead of doing it everything overnight?
For most people, based on, I teach a lifestyle medicine clinic at the VA hospital. We've been doing it since April of last year. Despite COVID, we've been extremely successful doing this. So what I've learned by talking, majority of people, it takes time. So my friendly suggestion is to do it in a way that you find it successful. Because if I expect, for me, majority of my lifestyle changes, they happened pretty much overnight. It's not like I weaned myself off my mom's Indian chicken curry, right? I did it overnight. And the thing that took me the longest is to give up dairy products. But every one of us have to find our own reasons, our own style, and our own, strengths and limitations as to how to make it happen. If I say that, do it a certain way because it worked for me, it may not work. But at the end of the day, the overall general direction is the same thing, because nobody argues about sleep, nobody argues about smoking, nobody argues about cutting alcohol. Majority of the argument, majority of the debate, majority of the discussion or difference of opinion is when it comes to diet. Because look, if I decide for a cardiovascular research paper and present it to lay people, I am, quote unquote, I am the expert, right? So, and I, whatever I say kind of goes. But when it comes to food, everyone eats. So, and everybody also deeply intertwined with their own culture, their habits. So we all feel like we are experts for our own life when it comes to food. And that's where deeply founded opinions and passions rev up, and people are constantly fighting about my diet versus your diet. But again, you have to do it on your own accord. You have to do it for reasons that you truly believe and you're truly passionate about. And we as professionals are here to support you. Just because I eat a certain way, I'm not going to kick you out of my clinic if you come back and tell me that you are eating some red meat. Right? I have to meet you where you are at and enable you to do it in a way that is practical for you. I don't know if I am, but that's what I found very useful.
I think that's an excellent answer. I think you very clearly said, very rightly said, that every person, every patient is a unique example, unique individual. Some people can do overnight. I did overnight. Dr. Reddy did overnight, but some people may take some time. The good thing about it is that when people start doing it, they start to reap the benefits so quickly that they actually speed up their process of going whole food, plant-based, no oil. They actually themselves speed up the process. So I let people take their own time. I just keep educating them. I keep holding their hand. And from my experience, they actually come back in a month and they say, I'm ready for the complete package now. They actually themselves are so ready within such a short time that I just don't push the thing. Let them just come out their own space and their own. The next question was, Dr. Reddy, was that a lot of the Indians, both Indian American and people living in India, why do they have much more higher chance of heart disease and diabetes?
I'm glad you asked that question because that question came to me through a private message on the Zoom chat. And the question is that, Dr. Reddy, why is it most Indians, while vegetarians, but yet we have highest number of heart attacks and diabetes and blood pressure? What are we doing wrong? So that was a question. I'm glad somebody asked that question. And so this is actually a nice thing. Somebody asked this question, like Dr. Shah said. Since you said, Dr. Shah, that you're going to bring me back every few months, I'm going to go ahead and volunteer myself that we should do a talk on this topic, because I actually have a talk that I presented at the inaugural Indian Society of Lifestyle Medicine meeting. I had the pleasure of sharing the presentation with none other than Dr. Dean Ornish. Dr. Ornish and I presented at the inaugural. It was held in Bangalore, and we did it from here. My presentation was recorded by a professional team in Orlando. So I have that slide deck. It needs to be a little updated. It's a couple of years old. So sometimes I call the talk Mother. Some people take offense to my title, but I called it Mother India, You Need Help. So the question, the very specific question here was that while most Indians are quote unquote vegetarians, right? Yes, we are vegetarians, but if you really look at our food, right now, not like the food that I used to see growing up in a small South Indian village, a lot of villagers eating, that's a different food. Now, the contemporary Indian food is a disaster. For lack of better words, I call it pseudo-vegetarianism. It's most of our food is, overcooked vegetables loaded with salt. By the way, if you really want to go into the statistics of this, most of you, again, I see some Indian names on the people who are attending. I'm willing to bet that you don't know a single household within your closest circle of friends and family where at least one person who is over 40 years is not taking a blood pressure medication. The reason for this is that an average Indian is currently eating about 140% more salt than what is recommended. And an average Indian person, our food is also loaded with ultra refined carbohydrates, loaded with a lot of vegetable oils and a lot of sugar, enormous amount of sugar, right? Before you know it, just simple things like, eating a dosa with very little or no oil is not a bad thing. But by the time you add coconut chutney to it and you sprinkle some oil on it and add some more salt in your sambar, you're already looking at 2 days worth of salt in one meal. So I have an entire, not just extemporaneously talk about this, but I actually have beautiful visuals and actual data from Indian Medical Research Council and a lot of cardiovascular centers in India. So our vegetarian diet is not truly a vegetarian diet. We need to go back to what people used to eat, our grandfathers' generations in the villages. Eat ragi grains, lentils and grains for breakfast, right? On top of all of this, what has happened in the last 20 years, since 20, 25 years, since Dr. Shah and I have left India and come here, American fast food has entered India. A lot of American fast food chains now actually make more money in India than they do here. On top of that, per capita meat consumption has gone up like you cannot even imagine. There's very impressive data on this. On top of that, per capita alcohol consumption, India is now the world's largest consumer of single malt whiskey, right? And what you will be shocked when we do the presentation in the near future is this change is actually happening just about as much in rural India as it is in urban India. So please don't fall for that. On top of that, we also have this syndrome called TOFI, T-O-F-I, thin on the outside, fat on the inside, right? Most of you Indian people or people of Indian origin who are listening to this would agree with me when I say that most of us, even when we are ideal body weight, even when our BMI is normal, we tend to end up having some visceral fat, right? So that uncle belly, we call it, right? So that visceral fat is an independent risk factor. So my suggestion to how to quantify this risk is not to go by BMI. If you're an Indian, your chances are that you're thin on the outside, but you're fat on the inside. Take a tape measure and measure your waist circumference, right? Just about the level of your belly button. Take a paper tape measure, and that measurement, the measurement in centimeters or inches around your waist should not exceed half of your height. If it does, it doesn't really matter how many pounds you can bench press and how much push-ups you can do, right? BMI can be misleading sometimes, but that measurement of visceral fat around your belly button, you can't fake that. It's just there and you're measuring it. So I repeat it again, the size of your body around your belly button should not exceed more than half of your height. So again, I don't know if I kind of a long-winded answer, sorry, but I just wanted to spend some time on that topic. It comes up all the
No,
time.
I think Dr. Reddy, you said it very right way. Not only we sometimes go by the standard Western criteria, but as Indian, we carry a lot more visceral fat for the same BMI. And I think measuring waist is such a simple tool. You can do it yourself. All doctors should do it, and that should become part of the standard vitals. And I think when people start exercising, start following lifestyle changes, not only they should follow the weight, but they should also follow how their pants measure or how their waist diameter is. So I think getting healthier doesn't mean losing weight. Getting healthier means lowering your body fat percent. So I think we are definitely bringing you back probably within a month to specifically talk about Indian American heart disease and heart disease in Indians itself. And that will be definitely a great presentation from you. So next question, I think you can read it on the chat box, that how does these changes are possible at VA hospital in general?
So like I said earlier, so I'll share my experience as to how I got into all of this. And, for about 5 years now, I want to say some 2015, 2016, long before I actually joined American College of Lifestyle Medicine, or, from a dietary point of view, went a completely plant-based, we were looking into, diet in general as to how influential it is. So when I started learning about it, and I was so drawn to it and moved by the power of, health, just by just one, not even all the lifestyle pillars put together, just nutrition alone. So I started doing a series of lectures at the Tampa VA hospital for patients, employees, colleagues, students, residents, and fellows. A title that I actually borrowed from Dr. One with permission, of course, with Dr. Furman's book. I believe it's Eat to Live. There's a chapter titled in the book, "Let's Not Dig Our Graves with Knives and Forks." So I used that as a title to kind of spread this message across all strata of healthcare providers and recipients. So that became a huge success. And then just around the same time, just before President Obama left office, he signed off on a national program called Whole Health. It's an extremely well put together program that's expanding on a yearly basis from multiple. Initially was started at 18 programs, 18 hospitals as what we call the flagship sites. So now it's gradually expanding to many other VAs. And we do this, actually 2 half-a-days a week. My employment at the VA and my salary at the VA actually does not come from cardiology. It comes from Whole Health. So what I do at the VA is that Friday afternoons, I hold a shared medical appointment where we invite veterans and their families to join us in person, now through what's called as a video connect through the VA. And usually about 10 to 15 veterans attend the class every week. And so the initial presentation is about 2 hours, just as long as we lasted here. But it's a very dynamic, interactive presentation. Up until recently, I actually did not even have a PowerPoint slideshow. I just wanted to have a conversation with a lot of these veterans and their families. So I chose not to have PowerPoint. And that conversation sometimes went for 2-3 hours. And so far, we have seen about close to 600 veterans, including the COVID crisis, attendees through Video Connect. And so what we have done is based on enormous demand from both patients, their families, and the referring providers. Hey, look, this is such an important message, but for most of us, just attending a lecture once, it may not be enough. You need to really build a program around it. So the first program, we call it the HEAL program, HEAL, stands for Healthy Eating and Living. That's the name of HEAL stands for. It's an official consult at the Tampa VA. We are planning on actually taking this national through whole health. So based on that success, we created a new clinic called the CALM Clinic, CALM, stands for Comprehensive Approach to Lifestyle Medicine, where we draw, enthusiastic and willing veterans and their families from the HEAL Clinic, but we make them attend a 6-week program. When I say 6 weeks, it's about 2 hours on every Friday. That's it, not an entire week commitment. But each week is dedicated to one pillar of lifestyle medicine. The first week, we talk about social relationships, right? It's extremely important because if I ask a 65-year-old, combat veteran from Vietnam, who is set, in his own ways, then I ask him to change 17 different things about his lifestyle. And even when he's willing, it's going to take enormous amount of support from every person who can support him within the VA, outside the VA, YMCA's, social networks, what have you. So we spent almost 2 hours showing them how to seek support to bring about this change. Week number 2, we talk about mindfulness and stress reduction. We actually have a board certified psychologist who teaches the class. Week number 3, we have a dietitian who comes and teaches the class on plant-based diets. And depending on her schedule, she actually cooks a meal in front of my patients. And week number 4, we have a cardiac rehab. The person comes and teaches them how to start and sustain an exercise program. Week number 5, we have the same psychologist come back and talk to my patients about how to prioritize sleep hygiene, right? And every section I am there physically. I'm literally there every one of these sessions, but I let the invited guest speaker take over. And week 6, we talk about how to put it all together. So we graduated one cohort because this is the second component is a relatively a new program. But just when we started the second program, we were hit with COVID. And so we haven't done that through virtual platform, but starting the first Friday of August, even the second COM program is going to go live through video connected the VA. So I presented this at the American College of Cardiology National Federal Conference, and we are pushing for this to be incorporated into as many cardiology departments across the VA as possible, because for what it is worth, the VA system is the largest integrated healthcare system in the country, if not in the world. And contrary to what many people may think, it's actually an extremely well-run program. So again, that's how we do it at the VA. I saw somebody ask that question. I thought I'll give a full-blown answer for that.
No, I think one thing I'll tell Dr. Reddy that you working at VA is a boon and is a kind of a blessing to every private healthcare system, because the research and the advancement you're going to bring, not just to VA, but to the whole country, will apply to every private system. Unfortunately, even though many times it's not very explicit, but many private care systems have interest in making money through a sick care. And I think that only can change when the profit model is removed from a system, even though it's unfortunate, but that's the way reality works. When there is a profit motive, many changes become very slow. When there's no profit motive, those healthy changes become much more quicker and much more faster. So I'm glad you are at VA, and we're gonna enjoy the benefit of you being VA. So that's a great thing. The next two questions we can lump it up in one. One was what is the guidance on ghee in Indian food, and what do you think of this keto diet and paleo diet?
So ghee in India is, again, to do this, right? I'll give an example. See, for example, open disclosure, since the issue of ghee came up, and trust me, just like most Indians, I ate bucket loads of ghee, right? I literally, teaspoons full of ghee being poured into my, everything, so to be able to make these changes, we have to put our a priori biases aside, right? We have to take the Indianness of us out of us. Because if you approach ghee because of our Indianness, the cultural barriers, the family barriers, the religious barriers, all of them, whether we like it or not, will influence our decision. We all have to put them aside and look at it from a purely scientific point of view, right? If you do that, ghee is actually bad for you. It is saturated fat. It increases your LDL, period. This is not even an issue, discussion, and debate. The data on this is extremely clear, right? And this could be one of the contributing factors within, amongst Indians. And I just in the interest of time, if anybody wants to dig deeper into the actual specific data on this, look up a website called CADI Research, CADI Research. I think .org or .com, but where all the research, CADI stands for Coronary Artery Disease in Indians, CADI Research. So there's an entire section on ghee. So please, try to minimize and avoid ghee, right? People say that, we've been doing it since the time of Vedas, but, that may be true or not true. I really don't know. I'm not an expert on Vedas, but how many other things that we do, like people did during the time of Vedas? How many of us wake up at 4 o'clock and start our life with Surya Namaskar? If you do all of that and eat a little bit of ghee, I'm okay with it. But we have become a sedentary society. We are eating too many processed carbohydrates. We're eating too much sugars. We are eating too much vegetable oils. And on top of that, you dump tons of saturated fat. It's not going to be forgiving. And in terms of keto diets, there are some populations that keto diet may help. One of them that has some reasonable evidence is people, young children with intractable seizures. Yeah, other conditions, the data is actually not convincing at all. If anything, the data is pointing towards it being harmful, right? If people lose weight initially, it works. Their quote unquote diabetes numbers get better, but over a long term, it's most people, it's very difficult to sustain, and also your lipid parameters, and there are many other conditions that tend to get worse. So be careful with again any one of these quote unquote dietary patterns, including vegetarian or vegan diets. Please do research, talk to an expert, seek counsel from a professional who will teach you how to do this on the private sector, and then embark onto it in a gradual fashion to see if it works for you. Yeah.
So we'll take two more questions, Dr. Reddy. One question is, if somebody's already on a whole food plant-based diet, what is the right balance of vegetables, fruits, and grains?
Majority of your calories should come from dark green leafy. You have to eat a lot of them. Like all of us say in plant-based diets, your majority of your section. When you imagine a plate like the Canadian plate, like more close to literally half of it was green leafy vegetables, lentils, and fruits. The next one is lentils and beans. And a very small portion should be nuts, very small portion, like very literally, I'm talking about something that fits in the size of your palm. But including breakfast, this is going to sound crazy, but including breakfast, a lot of times I actually eat sauteed kale for breakfast, including this morning. I actually put kale in my oatmeal, right? Tastes good actually. A lot of people think it's a weird, including my kids think that it's the weirdest thing I do with my breakfast, but eat large portions of dark green leafy vegetables with every single meal, and snacks if you choose to. Once you get into the space, it's going to sound crazy, but you will figure out how to eat snacks from kale and collard greens also can be done. But yeah, nuts, be very careful with nuts because they're addictive. They're high in calories. Before you know it, you emptied an entire bag. Right? Be very careful with nuts. That's the only caution. Otherwise, in terms of lentils and beans, first, lentils and beans, it's hard to overeat them because by the time you've finished half a portion, you are so full. Especially if you make a lentil and a bean soup with a lot of vegetables and some green leafies in it, halfway through, you're so full. So it's hard. And then the beauty with this is they're so low in calories. If you're hungry, you eat more again. Try doing that with pizza and cheeseburgers. If you eat more again, it's going to stay with you for a long time. But it's very difficult because they're so low in calories and high in fiber, you tend to get full. And if you're like me, you get to eat a lot.
No, I think I agree. I think there's an excellent resource which my wife and we are following, and that's a Chef Aajay. Not only she has invited Dr. Reddy, and Dr. Reddy and his wife was already on her show. We were on their show too, myself and my wife. So anybody listening to this presentation, either on Facebook or Zoom, if you have not seen Chef Aajay in action, she has like 200 YouTube videos with recipes and lectures and everything else, a lot of great books. So I definitely highly recommend Chef Aajay if you have not tried it. The last question we will take, I think which is an important question, particularly coming from an Indian person I know. He's a practitioner himself of one of the healthiest lifestyle. His name is Steve Sharma. And his question to Dr. Reddy was, what do you think of meditation and yoga when it comes down to healthy lifestyle?
Oh, extremely important. There's a lot of data. Actually, through Whole Health at the VA, we actually teach our patients. We actually offer yoga classes and mindfulness classes. Right, so extremely important because yes, these may appear as if they are some kind of acts of physical doing, but through mindfulness, meditation, yoga, there is actually what we call as evidence maps through our program. There's pretty convincing evidence that all of these should be and can be incorporated. Again, to do that, you don't really have to become some kind of a master yogi tomorrow. But so mindfulness and yoga are, in a truly healing sense, is to be able to sit down somewhere for 5, 10, 15 minutes and ask those deep questions if you're unhealthy. So the way I talk about mindfulness, or even in the sense of yoga, is I challenge my patients. Look, don't let me run your life and health, because quite often, if I am in charge of your life and health, I show up with a prescription and a catheter in my hand. That's what I get paid, and that's what I'm trained to do. But ask yourself this question. Why would you reluctantly take 2 to 3 blood pressure medications a day, right? Right? Like another example is cholesterol medications. Yes, dietary cholesterol may not have, as much influence on our cholesterol as we once thought, but simple logic, right? From a patient perspective, why would you go to bed taking a cholesterol medication, wake up in the morning and eat cholesterol for food in terms of bacon and sausage and eggs, right? Like, so to me, to think about it, the physical act of sitting there one day and thinking about what we are doing, to me, that is mindfulness. To me, that is, in a way, that is a part of being yogic about your lifestyle, that you are actually paying detailed attention to what you're actually doing in seeking health that matters to you. And, I'm not a, expert from yoga, but I do a little bit of yoga here and there. But in terms of the yoga as a science, there is fairly convincing evidence, including, cardiovascular medicine in terms of heart rate variability, arrhythmias, and all of that. So I strongly support people who do yoga on a regular basis.
Well, Dr. Reddy, thank you very much for one of the best presentation. We are bringing all different guests. We are bringing even a yoga instructor, yoga teacher from Chicago in a few weeks. So please stay tuned in that question. Again, this will be on YouTube in few hours. So if you want to share with your friends and family who missed this presentation, it will be available in YouTube. You can also reach out to our other YouTube presentation, including one on diabetes. So please follow our page, invite your friends and family, and let's all of us thank Dr. Reddy for one of the best presentation. Thank for his service to VA and to the country. And I can sincerely tell you, he always has been my mentor, my role model. And today, probably 50 on Zoom and many thousands on Facebook, he has become their role model and their mentor. So thank you, Dr. Reddy.
Thank you. Thank you, Dr. Shah. And we look forward to continued discussion, and best of health and joy to everyone. And please stay safe during this COVID pandemic. Okay.
Yeah,
take care.